Namaste. IJV Dr. Shaima Kadri from Faculty of Physiotherapy and Diagnostics. And today in this video, we are going to talk about scapula fracture or shoulder blade fracture. The shoulder blade or scapula is a triangular shaped bone that is protected by a complex system of surrounding muscles. Scapular fracture represents less than 1% of all broken bones, and many of them can be treated without surgery. High energy blunt trauma injuries, such as those experienced in a motorcycle or motor vehicle collisions or falling from a significant height, can cause a scapular fracture. Other major injuries often accompany scapular fractures, such as fractures of the shoulder, collarbone, and ribs, or damage to the head, lungs, or spinal cord. One more part of the scapula may be fractured, which is scapular body 50% to 60% of patients, scapular neck 25% of patients, glenoid, acromion, and coracoid. So we found spine, coracoid, acromion, glenoid cavity, scapula, neck, and body of the scapula. The symptoms of the fracture of scapula are extreme pain when patient moves the arm, swelling around the back of the shoulder, and scraps around the affected area. If we talk about the examination, physiotherapist will evaluate the position and posture of the shoulder because other injuries are often present with the scapular fracture. The physiotherapist will look for additional injuries. He or she will also treat any soft tissue damage like open wounds and muscular trauma. A detailed physical examination may not be possible if patient have other severe injuries. The doctor may also imaging test of the shoulder and chest to determine the extent of the injury of the scapula. X-ray provide clear image of dense fracture like bones. Doctor may also order a computer tomography scan to provide a more detailed imaging. If we talk about the treatment of the fracture of the scapula, where we found two kind of the treatment. One is conservative, which may also call as non-surgical treatment, and the another treatment is the surgical treatment. So first, let's we talk about the non-surgical treatment. The non-surgical treatment with a simple sling works for most fracture of the scapula. The sling holds the shoulder in place while the bone heals. Doctor may want to start moving the shoulder within the first week after the injury to minimize the risk of the shoulder and elbow stiffness. The sling is discontinued as the pain improves. Passive stretching exercise should be continued until complete shoulder motion returns. This may take 6 months to 1 year. The one more specific thing that um there is figure of 8 kind of or figure of 9 kind of bandaging is applied over the scapular fracture. If we talk about the surgical treatment, so there are certain types of scapular fracture which need surgery. Fracture of the glenoid articular surface in which bone are moved has moved out of place, displaced. Fracture of the neck of the scapula with long or lot of angulation. Fracture of the acromion process that cause the arm bone to hit against it. During During the surgical process, the bone fragments are first repositioned or reduced in their normal alignment and then held together by attracting metal plates with special screw to the outer surface of the bone. As we discussed about the pain management, after pain, Pain after injury or surgery is the natural part of the healing process. So, for the remover or for the recovering of the fast remover, the heating or cold pack may be applied as medications are often prescribed for the short-term pain relief after surgery or an injury. Many types of medicines are available to help manage pain, including opioids, non-steroid anti-inflammatory drugs, the local anesthetic. The combination of these medications to improve pain relief as well as minimize the need of the opioids. Be aware that although opioids also help in relief pain after the surgery or an injury, they are a narcotic and can be addictive. Opioid dependency and overdose has become a critical public health issue, so it needs to be focused on that. So, this is all about the fracture of scapula. If you have any queries related to this video, ask me in comment section. This video is powered by digital version of 2.0 Jyoti Vidyapeeth Women's University. खुश रहिए. Namaste.